Hello everyone, we're Group 7 and we're presenting on the topic Healthy Aging in Context of Climate Changing. These are our team members. Climate change refers to the long-term shifts in temperature and weather patterns. It leads to more frequent and extreme weather events which threaten lives and infrastructures. Food security is threatened by ocean acidification and disrupted ecosystems. Our health is also affected by poor air quality and the spread of insect-borne diseases. On top of that, responding to these challenges brings a major economic burden.
One of the vulnerable groups affected by climate hazard are the aged population, and these are the trends seen in the following decades, and these are the challenges faced by them due to climatic changes. Hence, they need a sustainable and age-friendly environment to help. In response, the United Nations and World Health Organization have launched a decade of healthy aging, aiming to address these challenges through coordinated global action. And these are some of the examples of age-friendly cities.
Healthy aging refers to the equilibrium between the dimensions of health, as neglect of any one can have adverse effects on the others. A large tenet of active and healthy aging is the intuitive adaptability to shifting needs as required by ourselves or others. The dimensions of health can be detailed in the following ways: physical, intellectual, emotional, social, spiritual, vocational, and environmental. The most important dimensions to consider for climate change are physical health and environmental health, which details how the conditioning and functioning of the body is impacted by its surroundings.
We have a psychological, social, and physical part regarding aging and the environment. That means the psychological one is more, they have higher vulnerability with a bigger chance of depression worsened by climate change. Together, we increase our risk suicide due to trauma and grief. Also, socially, they have social issues because they have more trouble getting caregivers and getting activities after disasters. Finally, in the physical part, aside of aging being a fit individual, they have a sensory decline and it helps on mental adaptation. Health systems on crisis, they tend to get overwhelmed and so their mental health decreases. Then they could also get a reduced physical health and mobility.
Other factors are inadequate housing, which influences on the exposure older people have to environmental risk. Second, lack of age-inclusive planning, since most disaster strategies overlook limitations from the population. And lastly, social inequality, which can determine risks to be faced, responses, and inclusion in protective systems.
Now, onto the solutions. The solutions include community resilience, usage of artificial intelligence and technological advancements, and then we will delve into which countries currently are employing these strategies. Firstly, community resilience is the ability to prepare for anticipated hazards, adapt to changing conditions, and withstand and recover from disruptions. By coming up with these strategies, we can achieve a resilient design for populations to lead healthier lives in the wake of climate change. Age-friendly designs promote accessibility, safety, and convenience and foster social inclusion for older populations. It's also important to delve into the benefits and disadvantages of using artificial intelligence. Some benefits include increased mobility, more effective usage of technology, although some disadvantages include glitches and any myriad of complications from advanced technological usage.
There are multiple examples of age-friendly infrastructure design being implemented around the world. New Zealand has designed age-friendly public transport waiting spaces that enhance accessibility by protecting passengers from the weather and having audio announcement systems. Water Square in Netherlands absorbs excess rainwater and releases it slowly into the soil and nearby streams to prevent flooding. The design provides physical resilience for climate change and also social resilience by providing a space for social gathering, promoting community engagement.
Ireland and other developed countries are applying universal design standards with age-friendly principles to housing in order to ensure adequate quality and safety for older adults. For example, houses must have entry-level toilets sufficient for installation of a walk-in shower, which many people with limited mobility require or would benefit from in terms of their safety. China is promoting the development of humanoid robots, brain-computer interfaces, and artificial intelligence technologies for elderly care, according to new guidelines aimed at deepening the country's elderly care service reforms. Although these examples are mostly from high-income countries, our suggestion is to implement similar principles in lower-income countries to prepare for aging populations in the context of climate change. The key principle to focus on is the accessibility of all spaces for older adults. One of the strategies to achieve this could be attracting developers from high-performing countries to initiate projects and investments in technology and infrastructure in low-income countries. For example, Japan spreads its ideas of smart cities by having development projects in Vietnam, Thailand, and Indonesia. That's all for our presentation. Thank you for listening.